2nd, 2021, this is Yato, who came to me from Southern California. And your story is you recently, in the last few months, got rapid onset rheumatoid arthritis.
Yes.
And no one knows why for sure. The doctors want to give you two potent drugs, methotrexate and prednisone.
Yes.
Ozone has helped you the best in the hands of one of my trainees.
Yes.
And for those watching from Southern California, his name is Howard Leibowitz, and he's a really good guy. He's one of our best. And it helped you.
Yes.
So we don't know why you have this, and I just want to make a video of your abilities right now on day one coming to me, okay? I'd like to see you get out of the chair and walk to the door. Okay, and come back and sit on the chair, please. Yeah, so my goal is to get you better and make a video of this and compare it to later on.
Okay.
And if we get you better, I'd like to be able to post you on YouTube. Is that okay?
Yes, it's okay.
Thank you. Can you close that hand?
No, this is as much
That's
as
as much as you can do. And how about the other hand? That's a little bit better.
That's better.
Okay. I notice all of your joints are affected. Your hips, your knees, your feet,
Yes.
your shoulders.
My feet are very swollen right now.
Okay, can you get your arms above your head?
Oh my God, I will try. I usually can't. But it's about as
Good enough.
as I can get.
Okay. Take a look at your feet, and I think anybody can see that these feet are very swollen. There's indentation right here from your socks and your shoes, and you lost all your landmarks on your feet. And that, I can see one reason why you just can't walk. You can go ahead and lay down, please. So there are your knees, all the way down to your feet. The only thing we've done at this point is we gave you a little local anesthetic to that socket where the tooth was pulled, right?
Yes.
Can you get up? All right, turn your head to the right and left. The other way. All right, let me see you get up and walk to the door, please. Let me see you sit down on the chair, please.
Much better.
What did you say?
I said it's much better.
Now let me see you get up.
I could not do that before.
You got up without your hands.
I could not do that before.
There is no doubt in your mind there's a big difference.
There's a big difference. And even when I was walking to the door before, I would have to wobble.
You were wobbling, yes.
Yeah. Because it alleviates sometimes the pressure.
Yeah.
So the wobbling, but I didn't have to wobble.
Good. Let me see you sit down again. My heart is racing.
And I've never, you just don't know. Since I was diagnosed with this, it's been, I need assistance to get up. I need assistance to sit down. I need assistance with everything.
Now let me see you get up and walk to the door again. Let me see you get your arms over your head, please.
Okay, this is about as far as I can raise them right now.
That's better than you could do before.
Yeah, before I was here.
Yeah, so or automatically you got better.
Yeah.
And while I didn't record the range of motion of your neck, it is better than it was
Oh,
before.
it's much better.
Much better.
Much better. I
Oh,
can
that
do
is
all the way.
dramatic.
And
That's
I couldn't do
dramatically
that
better.
before.
Bend your head back as far as you can. Oh my gosh. And now down. Touch your chin to your chest. That is dramatically better. That's dramatic.
Yeah.
I'd say your range of motion in your neck has doubled. Would you agree?
I definitely would agree.
Okay. The table, sit. Please lay down. That's a lot easier.
Much easier. Because before I had to, first in my mind, I would have to brace myself in my mind and then try to find something on the seat or wherever I was going to take some of the pressure away.
Okay, and can you sit up now?
Yes.
Pretty good. Okay. On a scale of 10, if you came in here with 10 points of pain, and I know you had 10 points of pain because you were miserable, and 0 was how you felt 5 months ago, what would you give me now?
So, can you repeat that again? I'm so sorry.
10 is 10 points of pain.
A pain?
0 is no pain.
Mm-hmm. Right now?
Yeah.
Maybe a 4, 3.
That's incredible to me. Even to me, with everything that I've seen in my life, that's even incredible.
Because I came in at a 10.
Open and close your hands, please.
Okay. I still can close this one. This one is still kind of.
Yeah. The issue you're going to have with things like that is the swelling.
Mm-hmm.
This isn't going to take away the swelling that fast, and the swelling's going to limit some of your motion.
Mm-hmm.
But it can reduce the what's called autonomic nervous system dysfunction,
mm-hmm.
and reduce inflammation, at least temporarily. What I just did is not a cure, you know that?
Yes.
It's a test,
mm-hmm.
and that's what you came to me for.
Yes.
Okay.
Mm-hmm.
I just asked you if they scraped out the tooth when they removed it, and what's your answer?
No. And I remember the dentist saying that he believed that he left he didn't even get all of the tooth out, that there was a small fragment of the tooth still left in there, and that it was all right. It's fine. It's fine.
My eyeballs are jumping out of my head. You see that? And no, it's not fine. How would you like it if I tied off the artery to your ovary, and I left that dead organ in your body?
No.
It's a dead organ.
Mm-hmm.
It's dead. It's decaying. And that's what's going on here, only it's worse. Because up here, you already have, your mouth is full of germs.
Mm-hmm.
All right? It's full of germs. So all those germs just went right in there with dead tissue.
Mm-hmm.
Now, I didn't know that at first. Now I know it. And, you know, when I sunk that needle into you to give you the test, I told you, I didn't even feel any bone there. It's like it's all liquefied. Mm-hmm. Right now, I think that's the source of your problem. And you've essentially given me a really strong confirmation by what you've been able to do. And it's just you're getting better in front of me. Walk
mm-hmm.
to the door again.
I couldn't do that before. That I know. I couldn't. I was wobbly.
Yeah.
And I wasn't walking that fast.
No, you were not. You were barely able.
I was walking very slow because that was the best that I could do.
Yeah.
And now I can walk with some speed. And I know I could not do that.
Okay, good. Thank you. Thank you for giving me permission to use your video. This is going to be good for education. I want the viewer to know that you drove 8 hours yesterday, from Los Angeles to come see us.
Yes, 8 hours.
I'm honored. And the reason why you drove is because you were afraid to get on an airplane because of the swelling.
The swelling of my feet. And in the past, my feet would always, before this condition, my feet would always swell. And I was like, they're already swollen to capacity. I was like, if I fly, I might not even be able to walk off the airplane. So in my eyes, there was no other choice but to drive.
Imagine you driving with those feet and with all your pain 8 hours. So here you are getting ozone therapy, and I just want to check and see what your hand can do now.
Okay.
So let's see what you got. No, got to see that part. Yeah, close it. That's almost a closed fist. Mm-hmm. That's much better than you did earlier, wouldn't you say?
A whole lot better than what I did earlier. A whole lot better than what I did earlier.
Great. At the end of the day, and you're about ready to leave, and comments.
Oh my God, I feel wonderful. Wonderful. I can't even explain how I feel. When I first walked in, I'll try to create a visual. I felt like I was a walking board. I was walking like a board. I was walking very slow, very stiff, and every inch of my body hurt. Every inch. Now I can bend my legs.
Let's see that.
I can walk freely.
Let's see you come to the chair and back.
Okay. I'm not in pain. I don't feel that pain. I don't feel the stiffness.
Gee whiz, no hands, and you can get out of that and walk to the door.
Walk to the
and
door.
walk to the door.
Range of
Go.
motion with my head. All these things. These are things I couldn't do any of these things.
Wow, you're hustling there before you.
And I'm moving fast.
Yeah.
I couldn't do any of these things. When I came in here, my level of pain from a scale of 1 to 10 was a 10. Everything hurt. And right now, 1.
1?
1. I
My
mean, I literally feel like I
gosh.
can run. I haven't tried it, but I feel like that because nothing in my body hurts right now.
Oh my gosh, you're just giving me flutters in my heart. And the ozone treatment, the systemic ozone treatment we did then did make a difference for you.
It made 100% difference.
And I can see it because you can make a fist now. And with this hand, do your best.
We're getting there.
We're getting there. Okay.
We're getting there.
Look, dear, you came into me with a lot of inflammation in your body. Your joints were swollen. They had effusions. And for us to get this kind of results in a day, no cortisone, no standard toxic stuff.
Prednisone, no methotrexate, all those things that was prescribed for me that would be toxic to my body and toxic to my liver. None of that.
Right. Well, you'll go back to LA. You're going to see a dentist. And
Yes.
you can get ozone there. You'll take some supplements. And I'm hopeful, very hopeful. Can't promise you. You know that.
Yes.
There's no promises. But I'm hopeful that you'll be one who can have a total recovery from an
Yes.
autoimmune disease. And I'm honored that you came up. I said that before. I'll say it again. And I hope we'll be friends for a long time.
Yes, we will.
Okay.
Thank you so much, Dr. Rowe.